Welcome back to the Business Mastery, the show where we dive into strategies, systems, and business models that help functional and integrative clinics not just survive, but scale. Today's episode is a big one. We're talking about something every clinic uses, but very few clinics optimize: pharmacy. And more specifically, why pharmacy integration is the future of functional medicine. I'm joined by someone who has fundamentally changed how our clinics operate, the Director of Pharmacy Services, Tyler Genema. Tyler, thank you so much for being here today.
My pleasure. Excited to be here.
I'm so excited to talk about this, but before we get started, tell our audience a little bit about yourself.
Absolutely. Thank you. So my name is Tyler. As you mentioned, I'm the Director of Pharmacy Services at Forum Health. I've been with Forum for almost 2 years now. And during that time, I've learned a tremendous amount about functional medicine, how to best integrate pharmacy into functional medicine, and just really excited to talk a little bit about that today. Prior to being with Forum Health, I owned and operated a network of pharmacies in Michigan. So I have a kind of a unique vision or context to be able to pair some of the challenges that happen at the pharmacy side and the ability to execute on a lot of the things that we'll talk about today, and really pair that now with being able to kind of close the loop on the provider side and by way of the EMR largely. So excited to get into it.
Thank you so much, Tyler, for that introduction. You've done some incredible things with your career. And before we get into the tech and the workflows, I want to set the stage with a little context. The complementary and integrative medicine industry is exploding. It's projected to grow from 29 billion to over 220 billion by 2033. Clinics are expanding fast. Patients expect more convenience, and prescribing is getting more complex. And that brings us to today's big question of why does pharmacy integration matter more now than ever? Tyler, let's get into it. From the macro view, what's happening in functional medicine that made pharmacy such a pain point?
I mean, there are a tremendous amount of things that we could go into, really from a large scale standpoint. The complexities that are just naturally occurring within a functional medicine practice, primarily through compounding on the pharmacy side of things. The complexities of knowing how to write a prescription, what's available at the pharmacy, answering questions that a pharmacist might have, understanding the cost that a patient is going to expect. All of those kind of complexities are really a very real challenge that functional medicine providers are facing. Pair that with an industry that's evolving very, very quickly and a patient base that is expecting really fast turnaround times, kind of one-stop options for a lot of things, as we see with a lot of online clinics, and kind of the traditional or not, rather the typical kind of online experience that a patient will have. Patients are expecting they engage with a clinic or a clinician, and everything is taken care of, including their medication. So the complexities that are involved with prescribing that, paired with a patient base that is largely expecting an
A
end-to-end
lot more.
service, exactly, really give us an opportunity to solve those problems for
Yeah.
our clinics and for our patients.
I hear a few things of why pharmacy has been such a big focus for us in our organization. There is a lot more variety, and the compounding market has expanded and expectations are higher. And I think also patient knowledge and access to knowledge creates a lot more educated patients, and patients bringing in, hey, I want to try this. Hey, I want to do this. So it's really creating more of a partnership with patients and clinicians. Also, there is a lot of complexities. There's the patient expectations. There's higher regulatory pressures. There's the variety and the range of products on the market. And I think with the patient expectations, we see this, I call it the Amazon effect. We live in a society now where people demand a certain level of turnaround time and concierge and convenience. Convenience has become king. And expectations are different now. Patients don't want to click around 5 different portals. We're all conditioned by Amazon, one click ordering, transparency, and speed. EMR integration is proven to increase efficiency, reduce admin time, and cut down errors. Clinics operating without integrations lose 6 to 10 hours a week to manual pharmacy tasks, and up to 30% of prescriptions never get filled when patients leave the EMR to order. When you don't have these integrations, the workflow and the process with the compounding pharmacies is click out of your EMR system, order the prescription on another, and then the patient needs to check out at your clinic. Then they need to wait for the pharmacy to call them or call the pharmacy to confirm that they want that prescription. Then they have to go to the pharmacy and get the prescription. There's about 3 to 5 additional steps that a patient needs to take, and they're not quick steps either. And you start losing control of the process. When we talk about pharmacy integrations from the efficiency standpoint, there's certainly tons of benefit as well for patient compliance.
Yeah, absolutely. Patient compliance is really the core of what we were trying to solve with really what we call our Pharmacy Direct program, and then what expanded into a pharmacy integration to solve a lot of these problems. As you mentioned, 30% or better of prescriptions are not filled by patients after they're prescribed. And that really is a number that takes into consideration all prescriptions that are being issued to patients. So imagine a patient is not able to execute on getting a lisinopril prescription from their local pharmacy. These are the same patients that we're prescribing a complex compounded medication that only one pharmacy in their whole geographic region may be able to do for who knows what price. And there's a whole process that is riddled with challenges for our patients. And really, like I mentioned, the kind of the Pharmacy Direct program that we created removes the majority of those barriers.
So what were the top pharmacy related bottlenecks that were happening before we get into the integration and what we've created?
Yeah, absolutely. I mean, and we can go through the process, and really all of these are pieces of the process that are challenging. You had mentioned patient comes in and asks for something specifically. It's something that's not really necessarily new to our providers. I mean, we do have patients and have always had patients that come in and are asking specifically for something, but now they are asking for things that they're seeing advertised on TV that are compounded medications or specific weight loss drugs or those sort of things. So
Mhm.
really, the very first step of the process, patient comes in, I am interested in this particular compound. The first question that we have is, where can we get that prescription filled at? You can't just send it to the local corner drugstore. We need to know and be able to close the gap for providers of where that prescriptions actually can be filled.
Mhm.
Fast forward to now, you have to know how to write the prescription. So you think about a cream. Are you writing the concentration of a cream that is 1 click per half of a milliliter or a full milliliter or a quarter milliliter? There are unique complexities and challenges associated with just accurately writing a prescription for a compounded medication. Then let's say you get all of those things solved, you know where it is, you know how to write the prescription, you send it off to the pharmacy that can actually fill the prescription. Okay, great. Traditionally, your part, the provider's part of the process is done. Well, now the patient has to be contacted by the pharmacy to see if they actually want the prescription or not. We know that, but the pharmacy has no idea if they should prep it now or in the future or wait
Mhm.
or any of that. So the pharmacy has to call the patient and get a hold of them. Then they have to get payment from the patient. The patient may or may not have any idea how much that prescription is going to cost. Usually the patient's first question is my insurance going to cover this? I pay all this money for insurance. Why doesn't the insurance cover it? Then we let's say that all of those pieces are done. Then you still have to close the loop with the patient of actually receiving the prescription, getting it shipped to them, and kind of the patient going about the therapy that you had initially set out to prescribe for them. So kind of each step in the process that we go through on multiple times a day for our patients is really creates complexities and challenges for the provider and for the office. And and also for the patients.
When that control leaves your ecosystem, if you don't know who you're partnering with and you don't know the level of detail or the customer experience from their end, that's still a reflection on the clinic, even though it's outside of the clinic's ecosystem.
Mhm.
So you get this reputation based on the partners that you choose as well. There's no status visibility as easily. You're having to log into multiple different logins. Maybe you use one person for HRT, another person for this. It can get confusing. It takes a lot of brain power. It takes a lot of admin time. One of the key reasons that we have created this program for us, Pharmacy Direct, is there were so many bottlenecks, and there was the reputation management, and there was the patient compliance, and the price transparency. All of those things all bubbled up so much that we knew we needed to take this next step, which is creating a program around pharmacy that allows convenience, reduced errors, streamlined workflows, speeding up fulfillment, all of those things. Tell me, Tyler, what was the vision of Pharmacy Direct and where are we today?
Absolutely. Great question. Really, the vision of Pharmacy Direct was once a patient left one of our clinics, their engagement in the process of completing whatever treatment it was that was decided on at their visit no longer required them to be engaged in the process or fulfillment. So when they leave the clinic, they know that the prescription medication, the compounded medication that they were prescribed will be arriving to them without them having to be involved within a couple of days of the their visit. So it was an entirely patient centered and patient compliance centered in that we wanted there to be a fully white glove service created so that when the patient left the clinic, they knew everything else was taken care of. The prescription was going to arrive at their door in a couple of days.
Very beneficial to the patients, very streamlined, a lot of steps taken out of the process that
Absolutely.
is so important. We start controlling the process, start controlling the experience. We improve the efficiencies on the clinic side of things. We improve the experience on the patient side of things. It's really a win 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 for
Absolutely.
everybody.
So a couple of things that we ended up, I guess, realizing through the process. So we created this system that was essentially patient centered at the front end. What we realized really quickly was that we needed an integration to accomplish this more efficiently from the clinic side of things. What we really realized is as we took on that process internally at our clinics, we actually, in essence, created a tremendous amount of efficiencies within the clinics. We now have a very systematic way to accomplish all of the things that I had originally talked about: what prescriptions are ready, how to write the prescription, what the cost is, where is available. All of that has been solved. So now we are no longer sending a prescription out to some compounding pharmacy through a fax and
Mhm.
having the rather the pharmacist call the provider or try to get a hold of the provider and say, well, did you want a Versa base or a Lage base, or what kind of base did you actually want this in? Is this a cream? Is this supposed to be applied however many times a day? The infinite amount of questions that can come up on the pharmacy side are no longer having to be asked because of the integration that we created. Those are all of the communication loop between the clinic and the pharmacy is solved. We no longer also have patients that are calling us and saying, I had no idea it was going to be $200 for the cream that you prescribed me last week. Like, isn't
There's
there
no more of
something
that
that my
back and
insurance is going to
forth.
yeah, isn't there something my insurance is going to cover? That conversation happens at the clinic prior to the patient leaving. They know how much it's going to cost. All of that is completed. And we also realized very quickly that patient compliance was really no longer an issue, at least from the standpoint of the patient receiving their medication. So when the patient comes in and the beautifully engaging visit with us, spends their hard earned money for our expertise. Part of that process involves a prescription. we know that the patient is going to receive that and going to be able to complete the treatment
Yeah.
course that we set out at the visit, which just
For
creates a perfect and beautiful
Yeah, for
system
all
for
the
our
time that
patients.
integrative and functional medicine providers put into their care plans, the lab reviews, the deep dives into our patients' histories, these treatment plans are so incredibly valued, and it's the reason they're here. They wanna know, "What can I do to get to my ultimate goal?" And if you've got that many people not being able to stay compliant with prescriptions, it's a key area for a lot of care plans. So, this integration that we've built for pharmacy into Power to Practice that is not just available for our Forum Health clinics, but we also offer this to our external users as well. This tech solution for pharmacy workflows reduces manual tasks by 40 to 60%. And these integrated systems have improved patient follow through to 85 to 95%. And so these emerging pharmacy tech tools are really focused on automation, reducing duplicate entry, and speeding up fulfillment process, and just really making convenience a and this concierge experience for our patients. This is where people underestimate the value. Pharmacy is not just clinical, it's an operational system. And at the same time, it's also a revenue system. One of the biggest wins has been that we've built pharmacy workflows that scale, and that's what smaller clinics want to understand. What can independent clinics take away from this? Can you tell us more about the integration that's available in Power to Practice and tell us about how that works?
The system is really great. And it was created to solve these problems. So, directly within Power to Practice, you launch into an iframe interface that is built out with Wells Pharmacy. We'll continue to expand these integrations in the future, but Wells Pharmacy is really our first and kind of biggest potential value add to this. So, right within Power to Practice, you launch into the interface. You have direct access to understanding exactly what compounds are available at Wells. So there's about 2,500 compounds that you can prescribe perfectly within the Power to Practice interface directly within the Wells system. So you launch the interface, you search for the compound and medication that you're looking to prescribe. Many of the compounds have kind of pre-built in directions and guidance to be able to prescribe them accurately. A lot of clinics are probably familiar with that process to some degree, but you can really use it as a tool to be able to accurately prescribe right within Power to Practice. You submit the prescription, the information directly flows into the patient's chart. So you don't have to go out of the interface and remember what you ordered or print a requisition or anything like that. You close the interface, save it. That information goes directly into the patient's chart. In addition to that, there is tracking information and status updates that flow bi-directionally between them. So if a patient calls 2 days after their visit and says, "Hey, I thought that this was going to be to me already," you can just go within the patient's chart in Power to Practice and see the status update from Wells on if it's still pending or active or shipped or what the status is. And then once it's shipped, you can actually
And
click
that's
right
all in the
into
EMR
the
system. They
tracking.
get to just go into the
Correct.
patient's chart while they're either prepping or checking up on things, and they're not having to go into a bunch of separate platforms to see what the status of things are. It's just all in
Yep.
one spot for them. I think
Yep.
that's
Exactly.
wonderful. I think that the industry in compounding and in pharmacy is growing so rapidly because of this new age of people understanding more about preventative lifestyle medicine. There is a lot more access to information. People are learning about peptides, they're learning about HRT. We just had the black box warning removed. So there's going to be even more conversations around these things. The US is spending on medications. What we are spending today is expected to grow 4 to 7% annually, meaning clinics managing meds must become more efficient because it's only going to continue to grow. The other piece of that puzzle is there is also ways to help keep the clinics financially healthy. We've vetted in and established a relationship with Wells Pharmacy. They're the first pharmacy integration that we have in P2P today. That's another piece that clinicians have to go out and do is they have to establish the relationship. They have to establish a bill a billing structure or procedure with that pharmacy, all of that's already taken care of here. And in addition to that, we're able to pass on savings to our clinicians. They can take that and pass it on to the patients, and they can take that and improve the margins of their business. And I think that's really important for clinics to understand that this can also be a revenue engine for clinics. Cost of functional and integrative medicine clinics are going up and up. And this is another tool to create financial health in clinics.
Yeah, absolutely. One of the beautiful parts about the Pharmacy Direct program, as we refer to it as, is it is really a white glove end to end solution, end to end program that includes medication in that process. So we think of it a little bit of the medication side and kind of including that in the charge that we are passing on to the patient. But really, what we focus on is monetizing the efforts that go into this process on the clinic side. So the admin costs, the clinical costs, the coordination, the shipping, the integration, all of these pieces kind of combine together to create a pharmacy direct program that includes a medication. So when a patient is paying for engagement in the pharmacy direct program for biased cream, they're paying for biased cream and all of the services that are being provided at the clinic.
Hmm.
The beautiful part about that is the processes that we're engaging in are a significant value add to the patient. They're saving the patient time. Oftentimes, we're saving the patient money, even including the cost for the service of Pharmacy Direct,
Hmm.
because of the prices we've been able to negotiate with Wells and some of the other, hopefully in the near future, additional pharmacies we're bringing on. Patient saving money, patient saving time, patient has transparency. All of this is connected in and kind of bundled together in a Pharmacy Direct program that is monetized in as revenue for the clinic and is really creating an incredible value add to the patients. That is the expectation of the majority of our patients. When they are going to one of the online sources for a weight loss medication or an HRT medication, they're not paying for the provider visit and then going and finding a pharmacy to fill the prescription and all of that. They're paying X amount of dollars for the service of getting a prescription issued to them and all of the other coordination and kind of white gloving that happens with getting
Or
that
even just like
prescription from
our providers'
issuance to the patient's
certification
door.
and their education and their expertise. We're getting into some really fun compounds. We've got peptides more readily available. There is a level of expertise, certification, and training that providers go through in order to safely and efficaciously prescribe these medications, and is, in my opinion, a reason for margin as well, because you have to keep up on this. You're continually educating yourself on these things, and the expertise that providers in this space invest into themselves. It's so fun to learn all of these things. You're also doing such a big service for your patients. On average, a functional medicine clinic writes 72 to 200 compounding scripts per month. And that represents 8,000 to anywhere to 30,000 in potential revenue, depending on the pricing. If you're doing your LDN, your thyroid, or HRT, you're probably going to have lower margins. If you're in the peptides, things like that space, you're going to have a little bit more. And then the pharmacy related errors dropping 70% when switching from dual logins to an integrated ordering system. And then patients also being twice as likely to follow through on care plans when the ordering process is seamless. There's just so many big wins for clinics
Mhm.
to integrate services. I know, and I know Power to Practice has a really great solution for people to get started. But for those clinics that might not be on Power to Practice, or what's the minimal viable pharmacy workflow they need to put in place?
Yeah, so really it's and it's really important to understand that as you build this out, it is not a monetizing of issuing a prescription. We really need to create something that is more than that for our patients, both to create value for them.
You have to have the right process and the right workflow and the right experience to
Yeah,
create that margin in your clinic. So there are things that
of course.
There's things that clinics not on par to practice that they can do to create an efficient, minimally viable pharmacy workflow. I think first and foremost, you have to know your partners. Are you going to bill to clinic? Are they going
Mhm.
to bill to the pharmacy? I think you have to foundationally understand what high level process you want and then find the appropriate partner and set that relationship up. I think that's number one.
Yeah,
Negotiate
absolutely.
pricing, understand, and we've got all of that done with our integrations on behalf of our users. But that's like the foundational step. One is who's your partner, know their inventory, know their pricing, negotiate their pricing. If they have any pricing updates, they need to be communicating that in a very effective way. So that communication has to be there with those partners.
Yeah, absolutely. And like you mentioned, those are all the things that we've effectively kind of laid out and negotiated with Wells, which they've been a really a tremendous partner in building this out with us and for us. So understanding, like you say, what's available, what the pricing is, and then connecting all of those dots in the clinic to create a service for the patient that includes the medication itself, but really connects the dots on all of the rest of the pieces. The kind of unique part about this in the way that we look at this is a lot of these processes are already happening within the clinic by way of just the nature of a functional medicine clinic. You're not just a standard office that's seeing 40 or 60 or however many patients a day, and you're writing prescriptions all day long and sending them to the Walgreens and CVS's of the world, and then it's the patient's problem. We're already largely taking on much of the burden of connecting the dots for these patients as it is. This
Mhm.
creates a system that makes that financially sustainable for us. We're now effectively monetizing that process for our patients and in recapturing some of the efforts that we're already largely putting into this. And that's really where the financial side of this is important to understand, is that really not adding a tremendous amount of work to the clinics. We can systematize this so that the work that was probably already being spent on admin tasks now can be spent on actual coordination of the
And depending on
service
the volume,
itself.
it's 6 to 10 hours of admin work a week. That's almost a full day for somebody once a week. What could you do with 6 to 10 hours a week if you didn't have to worry about the admin time and the burden? I mean, that's a
Or if you could use that admin time to be, or rather transition that admin time to a more clinic
yes.
coordination for the patient. So rather than spending the time getting the patient their cream, you can actually teach them about
Yeah.
how to effectively use it, or have a meaningful conversation with the patient about side effects that they're having,
I
or
don't
or
know if I
adjusting the
mentioned
dose.
this stat, but the pharmacy integration improves margins. What we've seen improves margins 5 to 15% in a clinic just because of the improvement in the workflow efficiencies, freeing up that extra 6 to 10 hours a week. Patients are happier, higher patient retention, better patient outcomes. They're sticking around longer. They're happier with their treatment plans and their protocols. This is what they came in for in the first place. And we're using that time to give it back to them as well. One of the things that we do really well is that we track and we do KPIs here. And we look at the script turnaround times, the error rates, the staff time spent, percentages filled. So we take a look at that, and all of those metrics are improving greatly with the pharmacy integration. My favorite business tip is standardized first, optimize later. You can grow any system that's standardized. You cannot scale chaos. So taking the time to plan this and do this well is going to be a good investment of time for clinics in the future. And there's so much opportunity. If you can improve your margin by 5 to 15%, what could that do for your for your community, for your work life? You deserve that. All of our providers deserve that. All of them out there.
Yeah, absolutely. Yeah, and I guess just to kind of riff off of that point, I monitor, kind of our team monitors turnaround time directly from Wells. We have a mechanism in place that at any given time I can see exactly what the average turnaround time is and drill down to individual patients and really kind of oversee on behalf of clinics and clinic's patients, the overall quality of the program that is being offered to our patients. It's kind of a unique position to be in, to have really a very strong advocate standing on the side of the clinic and the patient, as opposed to the side of the pharmacy. Now, I will say that obviously we have very community. I am a community pharmacist by heart, so I know how hard pharmacists work to offer a great service. That doesn't mean that continuing to advocate for even better on behalf of the clinic and on behalf of the patients
Yeah.
isn't a valuable thing to add. And that's exactly what I do.
And I know we're going to be doing some follow-up business mastery series to this episode. And I think one of the episodes I'm going to be really excited about is how our organization transitioned from Pharmacy Direct, because this is new for us for about a year and a half or so. We've been transitioning to this. We've seen really great benefits to this, both from the patient and the financial health of our clinics. There's still a transition period. There's still the ups and downs of transitioning into a new workflow. It's not breaking up with local compounding pharmacies. It was such a unique perspective from your standpoint, being a community pharmacist in your past, how much this actually improves relationships as well as it improved your experience and workflow and efficiency on the compounding side of things. So it was also a win for our partners and our local compounding partners as well. That's not something to be skipped over because there is misconception. What about my community and what about the partners that I've built? Because there are some beautiful, beautiful local compounders out there. And I absolutely love our partners in our communities and we leverage them just as much as we leverage our Wells Pharmacy integration too. There's
Yep.
time and a place, and we'll get into that in our next series. So stay tuned. It has an amplified effect on the compounding pharmacy side too. We're partnering and it makes things better on all aspects, the compounding, the clinic, and the patient side. So I just love that.
Yeah, absolutely. And I will never stand between or want to
No.
stand between our clinics in a local compounding pharmacy. Like I said, that's where I grew up
Yep.
effectively, was in that role. And and I have a tremendous amount of respect and still a tremendous amount of passion for that section of that kind of sector of the industry. That said, there's a place for those compounders and there is a
Mhm.
place for wells, and both can exist at the exact same time.
Absolutely.
What we've really clearly been able to see is that as we continue to engage and scale kind of in increase our knowledge of how to better function within the compounding pharmacy world, or to better communicate within the compounding pharmacy world, all of that transitions into communication with wells being better, which is where we focus primarily, but also communicating with your local compounding pharmacy even better than
Yeah.
it did before. I mean, we have a tremendous amount of instances where we lean on the information that we maybe have gained from having an interface. And then we go to our compounding pharmacy and say, hey, by the way, there's this new hair restoration product. You know,
Mhm.
our patients absolutely love using you. And we go that route for our patients. We already have a system built in to say, okay, now we know we need to actually send you the right information. We need to kind of systematize this a little bit better. And it really kind of rises what do you say, the rising tide raises
Raises
all
all
ships.
ships.
That's exactly what we have seen by being able to
Yeah.
execute this on a bigger level with wells.
Thank you so much. This episode really highlights the truth about functional medicine pharmacy. Your workflow is either a liability or it can be a major center for both compliance, patient outcomes, profit and margin in your clinics. The Pharmacy Direct program that Form Health has created, and in relationship, they've also offered this workflow opportunity to our existing power to practice users. It solves real problems, inefficiencies, errors, lost revenue, and it can create a seamless experience for providers, staff, and patients. Tyler, thank you for breaking down the vision and the future of pharmacy integration. If you are an existing user and you're curious about the integration, please reach out to our customer service. They're happy to give demos. If you are just curious about part of practice and this in general, our customer service reps are so intelligent and love just talking to people. Our EMR is also a business management and solution tool. We really pride ourselves on helping clinicians within and outside of our network scale and create financially sustainable functional and integrative medicine clinics in our communities. Because, like you said, the tide raises all of the ships. And so we want to be that tide. We want to help you. Reach out, schedule your demo, and join us again for part 2, where we dive more into business mastery. We're going to be focusing on our pharmacy series for the next few episodes. So stay tuned. Really excited to talk to you again in a few. Thanks, Tyler.
Thank you.